my name is Melanie and I'll be your nurse today. I have been instructed to do a chest examination. Is that okay with you?
Yes.
So I will need to touch you, and I'll have equipment that I'll need as well. And are you okay with that?
Yep.
Okay. So for the neck, we are going to inspect for symmetry. So the neck is symmetric and at the midline. We're checking for pulsations, and the JVP is non-visible when sitting upright. And lumps, I'm looking for lumps, nodules, no cervical lymphadenopathy or masses present. For the carotid artery, we're going to inspect. So we're looking at it as well as palpating it. And we're also going to auscultate with the bell. So the carotid pulses are equal bilateral, 2+, elastic, no broes. So for the trachea, I'm going to place my fingers here, and we're checking to see if it is in the center, and trachea is in the midline. When checking lymph nodes, there are 10 we're going to check for. We have the pre-auricular, the posterior auricular, we're checking occipital, the tonsillar, superficial cervical, submandibular, submental. We have the deep cervical chain, the posterior cervical, and we also have the supraclavicular. Did you have any tenderness in any of those areas?
Nope.
So lymph nodes are non-palpable and non-tender. Okay, for the thyroid gland, I'm going to offer you this water. If you can give me just a second. Okay, if you can go ahead and take a sip for me. Okay, and then I'm going to just place it to the side. And can you take another sip for me? Okay, so the thyroid is non-visible, but palpable when swallowing. All right, for cranial nerve number 11, I'm going to see if you can raise your shoulders for me. Great. Can you touch your chin to your chest? And can you tilt your head all the way back? Can you touch your ears to your shoulders? Okay, and can you turn your head sharp left and sharp right? Okay, the neck with smooth, even movements and full range of motion. Okay, so we are moving on to the posterior chest. If I can get you to turn around for me, please. So we're going to inspect the skin, and we're going to inspect the shoulders and the neck muscles, as well as the thoracic cage. So for the skin, we're checking cyanosis, and I'm also noting that the color is consistent with the genetic background. And the shoulders, neck muscles look symmetric bilaterally. And the as far as the thoracic cage, I see that the anterior posterior is less than the transverse diameter. All right, for the palpation, I'm going to palpate some of the muscles in the back. We're also going to do symmetric expansion and tactile fremitus. So if you'll just tell me if you have any pain. We're checking the sternocleidomastoid. Okay, we're also checking the trapezius muscle. Any tenderness?
No.
Okay. We're checking the spinous process, as well as the paravertebral muscles. Any tenderness?
Nope.
Okay, so no tenderness to palpations, no nodules or lesions. For symmetric expansion, I'm just checking to see if my thumbs will move equally. All right, if you'll take a deep breath for me. And again. So bilateral symmetric expansion. For tactile fremitus, I'm gonna check 5 different areas, and I'm expecting resonance over lung fields. All right, can you say 99 for me?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
So resonance over lung fields. Okay, I'm going to percuss all the lung fields. There are 9 different areas that I'll check, and we're also going to check the costovertebral angle. Excuse me. So resonance in all lung fields. All right, I will need to auscultate in the same 9 areas that I just percussed. Actually, that is after we do the costovertebral angle. So you're going to find the 12th rib, and we're checking for pain. So let me know if you have any pain, okay?
Okay.
Any pain?
Nope.
Okay, so no CVA tenderness. All right, and now we will auscultate in those same 9 areas that we percussed, so that you're not out of breath. I'm gonna have you deep breathe in the first few, and in real life, of course, I would just take longer to assess all 18 areas. Okay, deep breath for me. I'm just going to show the spaces, and I'm just comparing both sides. So lung sounds clear, no adventitious sounds. Okay, so now we would like to look at the anterior chest. So if you don't mind turning around for me. So we would inspect the skin as well as respiration. So for skin, again, no cyanosis, no lesions. Respirations are 16 a minute, even and relaxed. For palpate, we are going to do the tactile fremitus, and on the anterior chest we're also going to palpate for tenderness. So just let me know if you have any tenderness anywhere. Okay, any tenderness?
Nope.
Alright, so for the anterior chest, no tenderness to palpation, nodules, or masses. And we will do the tactile fremitus, and there are 4 different areas on both sides. So if you can say 99 for me each time I touch your chest.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, tactile fremitus equal bilaterally. And when we percuss, there are 5 spots on the anterior chest that we will percuss. Can you raise your arm for me? Okay, resonance in all lung fields. And when we auscultate, we'll be auscultating in those same 5 spots on both sides. Okay. And deep breath for me. And lung sounds clear in all lung fields, no adventitious sounds. All right, thank you.